Bismillahirrahmanirrahim. Assalamu alaikum warahmatullah. Here we have MRI of the face. We can see there is abnormal infiltrating soft tissue involving content of the left orbit, infiltrating extraocular muscle, left eyeball, preseptal region, extending along left side of the face, just anterior to the left maxillary sinus. You can see part of the nose is also involved, and here we see left side of the maxilla, which is also surrounded by this infiltrative soft tissue, and it surrounds and involves left muscles of the mastication, left side of the cheek. Here we can see infiltrative tissue along left side of the body of the mandible and ramus of the mandible. We can also see this on T2-weighted axial images. Infiltrative soft tissue is noted around and along left side of the face, around left side of the mandible, involving muscles of the mastication. Here we can see, and we can compare this side with the contralateral side. Here the face and subcutaneous fat is normal, muscles of the mastications are unremarkable. Here we can see abnormal bulky infiltrative soft tissue in this region, involving entire of the left half of the face anteriorly, anterior aspect of the maxilla. Cranially we see there is deficient greater wing of the sphenoid at this level, while we can see size of the middle cranial fossa, which is also increased on left side, associated with left eye proptosis, favoring dysplasia of left temporal bone, which is a typical finding noted in neurofibromatosis. So here we see enlarged sized middle cranial fossa, partially absent greater wing of the sphenoid, anterior protuberance of the left temporal lobe, and here we see left eye proptosis. And we can also compare optic nerve, medial and lateral rectus muscles on right side are clear, and here we can see infiltrative abnormal soft tissue surrounds all these structures and extends in preseptal space. Similarly, we see unidentified bright objects. Here we have pons. We can see this in right middle cerebellar peduncle, left cerebellar hemisphere, in medulla oblongata on either side, and in supratentorial compartment along right medial temporal lobe, parts of crus of the midbrain, globus pallidus nuclei, posterior portion of both thalami, and here we can see there is involvement of posterior limb of the right internal capsule. So these are all unidentified bright objects. We call them as UBOs, which are basically hematomatous lesions. So this is a typical case of neurofibromatosis type 1. Thank you very much. Assalamu alaikum warahmatullah.